Social distancing.
Or if she's not ready, can we have the song first? Are you ready or you can? Because I wanted us to sing when we know why we are singing. Now we celebrate what we have to sing.
MULAGO National Referral Hospital, but under MULAGO Specialized Hospital, admitted its first case of COVID-19 on the 25th. This great team of medical workers have taken good care of all the patients. Currently, we are having 23 patients under our care, and today we are happy to discharge 4 of the 23 patients. It wasn't an easy job like it sounds when I say it in just 1 or 2 sentences, because these patients, they come when they are psychologically traumatized. So we've had to work hand in hand with the psychotherapists and the psychiatrists, and they've been great. We have a team of medical officers and the specialist physicians who are reviewing patients regularly. The patients also at one time were complaining that we are checking on them too frequently. They didn't know that they are a delicate category of patients that we needed to monitor very closely. As you know, when you suffer from this COVID-19 virus infection, you may have other illnesses which may arise along the way, or which you may have come to hospital with. And we found that many of our patients had other kind of medical problems that we had to deal with, and that kept us on our toes. But I'm very grateful for the support from MULAGO National Referral Hospital's administration, for the support, and from the commitment and the hard work of all the medical workers, right from the specialist physicians, the nurses, the catering, the cleaners, the guards, the pharmacy, all of you. I can't mention all of you. What we are celebrating today is the success, and of course we are honored that the ministry entrusted us with that responsibility of taking care of these patients, and we are glad that we have done our bit, and God has done his bit also of healing our patients. So it's my pleasure and honor to hand over the certificates and discharge forms of the 4 patients who we've looked after and have tested negative according to the protocol of Ministry of Health. I hand over their discharge forms to the Executive Director of MULAGO National Referral Hospital.
Thank you very much. Thank you very much.
Now, I think it's now time for the Executive Director to give a few remarks, and after that, the celebration of our victory.
And you can explain why we cannot have the because we have not presented.
Yes. After he has given his remarks, the medical team, in celebration of our victory, want to sing a song, and because we are very, very happy that we have reached this far, and that we shall do after your remarks, sir. You are most welcome, Idi.
Thank you very much, Master of Ceremonies. I thank everybody who is here, particularly the great team of the MULAGO National Referral Hospitals, the doctors, the nurses, the pharmacists, the great team from UPDF, again the doctors and the nurses and other people who have come, the great team from UPDF, the security people who have provided security to us, the security people around the MULAGO from ASCA Limited, the people who have come from the kitchen who have given food to the people we are discharging, as well as the sweepers who have cleaned the wards, especially where the patients are and who are really more prone to the virus in event was there. The people who are carrying garbage, again, and the people in the laundry who are also washing the bed sheets and other clothes of the patients. I'm very grateful. I cannot be very grateful and thank everybody and mention them by name, but I thank them. They are very good and wonderful people, capable of value reasoning, not only for themselves, but also for others, as exemplified in sacrificing under this lockdown to really work and look after fellow Ugandans. I'm very grateful. I'm also very grateful to you, the media fraternity, for coming to witness what we are doing today. I'm very grateful. And please, when called upon, come again and again and again and be with us and celebrate with us. Today we are very happy. I thank you very much. I'm very grateful to the Ministry of Health, because with the Ministry of Health we are working with them. We have a team from the surveillance and with whom we are working, and also, of course, the stewardship, the leadership of the Ministry of Health with whom we are working. And I'm grateful to the President of the Republic of Uganda for putting this lockdown so that it lessens the number of patients that are coming to MULAGO Hospital. Otherwise, had we not put this lockdown, I can assure you, probably would be doing badly than we are doing today. A few things really that we need to point out. We have managed the 23 patients. I don't need to go into what the Deputy Director has already said. And we are discharging the 4 now. Now, we are discharging these patients despite the fact that some of them had other comorbidities like hypertension, diabetes, and others, which are normal in the population anyway. To have diabetes and hypertension, it's common in the population. However, the great team of MULAGO Hospital has done it. I also recall that this great team was used to be consulted to go to Entebbe and also do the same. And they also went there and also did it. So they did it there, they are doing it here, they have also done it here. So we always do it. The few challenges that we have in doing this are as follows. Obviously, everybody will know that we, as I said before, that we are very ready to treat any patient of COVID that comes here. But if the patients are too many, of course they will overwhelm us. Why? Because the number of ventilators that we have in the hospital, the number of the monitors we have in the hospital are not enough if we had, for example, 1,000 patients. So we call upon the Ministry of Health and the government at large that MULAGO Hospital and other hospitals in this country, the time is now to prepare so that should we have bigger numbers in the future, we should be able to manage them. I would also say that in MULAGO Hospital we need like another extra 700 ventilators, 700 monitors, and our oxygen plant is good, but the pressure cannot fill the entire hospital. So we need another oxygen plant, for which procurement has already been able to go on and award to the best contractor to a tune of about 0.9 of a million US dollars, and which money actually we don't have because our capital development in the first quarter has been cut. So our hands are also cut. We cannot, our hands are not cut, actually they are tied. So we cannot pay for the oxygen plant actually that we need, which actually we need. And also believe that other regional hospitals that do not have the ICU, the time is now to have ICU, to have monitors, to have ventilators in the event, even if this COVID, this one we have, this epidemic has gone. If it comes back maybe another 5 years or so, it will find us extremely very ready, and we shall not be asking questions, how many ventilators, how many ICU beds do you have, and so forth and so forth. This one has been, is an eye-opener to our health system. Where are we and what can we do? We have a number of other things like the health workers capable of working in the hospital. Of course, when there is a lockdown and the health workers are not sleeping here, some are in Matuga, others are in Seta, others in Kosokoso, Kosokovu, and others, and other areas which I can't even mention. It's very difficult that they come from there and come and work. Even when we put a bus, it goes on trailing and trailing, it picks some are not on the road, others are hidden very far, and so forth. That's why we as MULAGO National Referral Hospital took a decision that we must build houses for these health workers so that they sleep around. In fact, uniformed workers, whether it is the army or police or anybody who puts on a uniform, is supposed usually to sleep around the place of work. Even in Europe, you find these health workers are sleeping in here, so that when you want them, in the event there is a big emergency, a super emergency, you are able to get them where they are. But now we are going looking, which is not really, which decreases our efficiency in managing the patients. That's why I call upon the government that the MULAGO Hospital, National Referral Hospital, is also going to put up again another 150 units. We need support. We need funds. Although, of course, our capital development has been taken. For example, in this first quarter, we have not received the capital development. But we need money. We need the money to build houses so that these people are accommodated, so that next time we don't suffer what we have suffered now. This is a lesson. To me, it's a good lesson I have learned. But then the question is, what have I learned? What I have learned is that I need houses, I need equipment for these health workers. And we need to deploy many health workers. We have got, of course, like funds in my wage bill, but we are unable to recruit. Why are we not able to recruit? We are unable to recruit because when the recruitment started, I think this time people say COVID also came in, and they are not able to recruit. But sometimes the year in, year out, we don't have enough human resource and yet we have got the funds. So the time is now to bridge these gaps, to make sure that we are any other pandemic or epidemic that finds us actually when we are solid. And in that way we shall fight the epidemic and shall be there. Back to the patients, of course Almighty God has helped us so that our patients don't progress into severe disease of the virus. God has helped us. Whether it is God who has done it, or it is because we have got our immunity as black Africans, whatever it is, we have been very, very grateful. Once again, I thank the President of Uganda for putting the lockdown, and actually to make the lockdown continue until the final diseased person is found out, because there are some other people who would be sick, but they will not show that they are sick at all. So they are there in the population. Even me, I could have been sick, but I didn't show anything. So such people are there, and they keep on transmitting the virus. So people should not say, but why lock down? We are supposed to lock down, even lock down more than 21 days, so that those people are corrected, and we treat them, and they become okay. So back to the patients. Our patients have done very well, whether because of the reasons I've told you or not, but I'm grateful to Almighty God. And once again, fellow colleagues who have done the work. I thank you very much, and I wave for you in thanking you, so that I cannot touch your hands. At this, with those few words, I have now the great pleasure to hand over these certificates to the representative of the patients, so that the honorable representative of the patients will give them to the patients. Why don't you have the patients here? We don't have the patients here because we don't want to stigmatize them. If I showed them here over the media, everybody will say, so you had this, so you had this. No. We don't want to stigmatize these patients. They are our brothers, they are our sisters, and once we discharge them, we tell them a date when they are going to come. We are going to keep in touch with them. We have not said go away. No. They are ours. They are now our brothers and sisters. We keep in touch with them, and that's why I have not called them here. So the representative of the patients, I'm very happy that your brothers and sisters have recovered. I now hand over. You are a great social worker who has done a great job, and please don't stop there. So I hand over these certificates that you continue. You give them the patients, take them home to their home, and keep looking after them together with us. In the event of any challenge, we are there to work with you and save our brothers. Thank you very much. Here I hand over. Yes. So thank you very much.
Thank you very much, Idi.
Can I go away?
Thank you, everyone. Congratulations, workers, for the work well done. And as I said, in celebration of our achievement, we want to keep us all. I don't know who the fire leader is.
Refer to the clinical aspect for the benefit of people coming, the first coming.
On the 25th of March 2020, we admitted our first case. And over time, we've been looking after a total of 23 patients, 10 of whom are females and 13 males. The patients came in because they had been diagnosed with a test which showed that they were positive for COVID-19. And on admission, of course, we knew they were COVID-19, but we take them on as wholesome, and we manage them wholesomely. Our patients were being monitored at least 3 times a day, checking their vitals, including the temperature, blood pressure, blood sugar, and we took off blood samples for various tests, which helped us to manage them as our patients. And in addition, they had a chest X-ray, all of them. And according to the results, apart from the supportive treatment, which included high doses of vitamin C, we gave them specific treatment according to any other comorbidities or any other illnesses they had. As the director said earlier, some of them have